This is the Zimbabwe Robert Mugabe doesn't want you to see. People reduced to scavenging in the rubbish dumps, searching for anything of value, just trying to survive in a country where unemployment is now at 80%. Zimbabwe's downfall would be hidden from the world if Mr. Mugabe had his way. Journalists face arrest here, so we had to pose as tourists, catching glimpses of the second city Bulawayo through the car window. The president's policies have literally destroyed lives here.
He was born 2003, is it? And he died in 2008, so he was about 5.
We've concealed the identity of this gravedigger, but he wanted to show us the fresh mounds of earth in the children's section of the city's cemetery. The graves of babies and infants who've died in the past few months.
Now I can see there's a great change. The number is still increasing.
More people are dying.
People are dying.
And they're dying young.
Yeah, each and every day.
The adult section in the cemetery tells the same story, each mound marking out a life cut short. Most people in Zimbabwe don't even make it to middle age now. The average life expectancy for women is 34 years, the lowest in the world. For men, it's just 37. All of this the result of poverty, AIDS, and the near total collapse of the healthcare system. Zimbabwe used to have the best medical care in Africa. Now it's one of the worst places in the world to be sick. We're on our way to one of the main hospitals in Bulawayo. Now, obviously, we're not allowed to go inside there with a camera, but we have got a secret camera. And we've arranged to meet a doctor here who's willing to show us around. So hopefully, we'll be able to get an idea of what life is like as a patient in Zimbabwe today. Okay, here he is. Hi. How are you? We'll go. So this is the casualty waiting area. All of the patients here will have to pay for their own treatment when they arrive here, and obviously most of them can't even afford to come into hospital at all. We moved on through the hospital, which seemed clean and orderly, but the staff told me even basic equipment like IVs are in short supply, along with most drugs. So if you don't have the IVs or the drugs,
what can they go and buy? We give them prescriptions to go and buy.
And where can they go and buy?
They go and buy in the chemist in town.
And if they haven't got the money?
They turn they change to another drug.
You give them a different drug, sometimes not the best drug. The staff working here get paid less than £20 a month.
The working conditions are pathetic. There's nothing to use for patients, and you can't help the patient, you can't help yourself.
Even if you're healthy, life in Zimbabwe is a struggle now. Fuel is as precious as gold here, and with 100,000% inflation, the money is almost worthless. Counted out in $10 million notes. Even if you've got cash, you can't buy much with it. We found many of the supermarket shelves empty, and what little food there is goes up in price every day. Tea, $29 million. President Mugabe tells his people that foreign sanctions are to blame for the collapse of the economy, but it's a lie. This is all his own work. 8 years of disastrous land reforms, which have brought the country he liberated to its knees. No wonder he doesn't want you to see this. Emma Hurd, Sky News in Zimbabwe.